Thank you for joining us today for CPR, AED, and First Aid Basics. Sudden cardiac arrest is one of the leading causes of death in the U.S. Over 350,000 people will suffer from sudden cardiac arrest this year. It can happen to anyone, anytime, anywhere, and at any age. Cardiopulmonary resuscitation, or CPR, is a life-saving technique useful in many emergencies, including heart attack or near drowning, in which someone's breathing or heartbeat has stopped. The American Heart Association recommends that everyone, untrained bystanders and medical personnel alike, begin CPR with chest compressions. It is far better to do something than to do nothing at all if you're fearful that your knowledge or abilities aren't 100% complete. Remember, the difference between you're doing something and doing nothing could be someone's life. When the heart stops, the lack of oxygenated blood can cause brain damage in only a few minutes. A person may die within 8 to 10 minutes. CPR can help keep oxygenated blood flowing to the brain and other vital organs until more definitive medical treatment can restore a normal heart rhythm. Before you begin, before starting CPR, check, is the person conscious or unconscious? If the person appears unconscious, tap or shake his or her shoulder and ask loudly, "Are you okay?" If the person doesn't respond and two people are available, one should call 911 or the local emergency number, and one should begin CPR. If you are alone and have immediate access to a telephone, call 911 before beginning CPR, unless you think the person has become unresponsive because of suffocation, such from drowning. In this special case, begin CPR for 1 minute and then call 911 or the local emergency number. If an AED is immediately available, deliver one shock if instructed by the device, then begin CPR. Compressions. Compressions restore blood circulation. In order to complete it, you would put the person on his or her back on a firm surface. Kneel next to the person's neck and shoulders. Place the heel of one hand over the center of the person's chest, between the nipples. Place your other hand on top of the first hand. Keep your elbow straight and position your shoulders directly above your hands. Use your upper body weight, not just your arms, as you push straight down on or compress the chest at least 2 inches or approximately 5 centimeters. Push hard at a rate of about 100 compressions a minute. If you haven't been trained in CPR, continue chest compressions until there are signs of movement or until emergency medical personnel take over. If you have been trained in CPR, go on to checking the airway and rescue breathing. Now watch the short video demonstration on hands-only or compression-only CPR. Automated external defibrillator, or AED. An AED is the only effective treatment for restoring a regular heart rhythm during sudden cardiac arrest and is an easy-to-operate tool for someone with no medical background. Time is of the essence. The average response time for first responders once 911 is 8 to 12 minutes. For each minute defibrillation is delayed, the chance of survival is reduced by approximately 10%. An automated external defibrillator is a lightweight portable device that delivers an electric shock through the chest to the heart. The shock can start an irregular heart rhythm and allow a normal rhythm to resume following a sudden cardiac arrest. Sudden cardiac arrest is an abrupt loss of the heart function. If it is not treated within minutes, it quickly leads to death. Most sudden cardiac arrests result from ventricular fibrillation. This is a rapid and unsynchronized heart rhythm starting in the heart's lower pumping chambers, or the ventricles. The heart must be defibrillated quickly because a victim's chance of surviving drops by 7 to 10% for every minute a normal heartbeat isn't restored. Why are AEDs important? AEDs make it possible for more people to respond to a medical emergency where defibrillation is required. Because AEDs are portable, They can be used by non-medical people. They can be made a part of the emergency response programs that also include rapid use of 911 and prompt delivery of CPR. All three of these activities are vital to improving survival from cardiac arrest. How does an AED work? A built-in computer checks a victim's heart rhythm through adhesive electrodes. The computer calculates whether defibrillation is needed. If it is, a recorded voice tells the rescuer to press the shock button on the AED. This shock momentarily stuns the heart and stops all activity. It gives the heart the chance to resume beating effectively. Instructions guide the user through the process. AEDs advise a shock only for ventricular fibrillation or another life-threatening condition called pulseless ventricular tachycardia. Who can use an AED? Non-medical personnel such as police, fire service personnel, flight attendants, security guards, and other lay rescuers who have been properly trained can use AEDs. Are AEDs safe to use? AEDs are safe to use by anyone who's been trained to operate them. Studies have shown that 90% of the time, AEDs are able to detect a rhythm that should be defibrillated. And 95% of the time, they are able to recommend not shocking when the computer shows defibrillation is not indicated. Now watch the short video on using an AED. Basic first aid for bleeding. Almost all bleeding can be controlled. Mild bleeding will usually stop on its own. If severe bleeding is not controlled, it may lead to shock and eventually death. Basic first aid for bleeding includes covering the wound with gauze or cloth and apply direct pressure to stop the blood flow. Don't remove the cloth. Add more layers if needed. The cloth will help clots form to stop the flow. Elevate above the heart. Use pressure points. In most cases, applying a tourniquet may do more damage to the limb than good. The 2010 American Heart Association guidelines also discount the value of elevation and using pressure points. Basic first aid for burns. The first step to treating a burn is to stop the burning process. Chemicals need to be cleared off. Electricity needs to be turned off, and heat needs to be cooled down with running water. Sunburn victims need to be covered up or to go inside. No matter what caused the burns or how bad they are, stopping the burn comes before treating the burn. Take these first aid steps. Flush the burned area with cool running water for several minutes. Do not use ice. Apply a light gauze bandage. Do not apply ointments, butter, or oily remedies to the burn. Take ibuprofen or acetaminophen for pain relief if necessary. Do not break any blisters that may have formed. Basic first aid for blisters. Whether or not a blister needs any treatment is debatable. If the blister is small, unbroken, and not very painful, it is probably best to leave it alone. Cover it to prevent continued rubbing and pressure on it that can cause it to swell more and possibly burst on its own. If the blister is large or painful, especially if the activity isn't finished, such as you are in the middle of a hike, follow the steps to drain and dress a blister. Use a sterilized needle and make small punctures at the edge of the blister and express the fluid. Then apply antibiotic ointment and cover it to protect it from further rubbing and pressure. Basic first aid for fractures. All extremity injuries need to be treated as broken bones or fractures until an X-ray can be obtained. There are all kinds of broken bone myths, such as not being able to walk on a broken leg, or whether there's a difference between a fracture and a break. If you don't have Superman's X-ray eyes, treat it like it's broken. Take these steps for a suspected fracture. Don't try to straighten it. Stabilize the limb using a splint and padding to keep it immobile. Put a cold pack on the injury, avoiding placing ice directly on the skin. Elevate the extremity. Give anti-inflammatory drugs like ibuprofen or naproxen. Basic first aid for sprains. The symptoms of a sprain are almost exactly the same as that of a broken bone. When in doubt, first aid for sprains should be the same as broken bones. Immobilize the limb, apply a cold pack, elevate it, take anti-inflammatory drugs, and see your doctor for further diagnosis and treatment. Basic first aid for nosebleeds. Most of us have had a bloody nose at some time in our life. It simply means bleeding from the inside of the nose due to trauma. The biggest cause of a nosebleed is digital trauma, otherwise known as picking it. The first aid for nosebleeds include lean forward, not back. Pinch the nose just below the bridge. Don't pinch the nostrils closed by pinching lower. Check after 5 minutes to see if bleeding has stopped. If not, continue pinching and check after another 10 minutes. You can also apply a cold pack to the bridge of the nose while pinching. Basic first aid for seizures. First aid for a seizure is aimed at keeping the person safe until the seizure stops on its own. Most seizures last from 30 seconds to 2 minutes. Stay calm and reassure bystanders. Loosen any clothing around the person's neck, like clothing, ties, jewelry, etc., that may impede breathing. Do not restrain the person. This may result in injury. Do not put anything into the person's mouth, and do not try to hold the tongue or force the mouth open. This may also cause injury. Clear the area around the person and remove any objects that could injure them, such as glasses, furniture, etc. Put something flat and soft under the person's head. After the seizure, lay the person on their side to facilitate breathing and keep the airway open. Do not leave a person alone after a seizure. They may be disoriented or confused. If the person is known to have epilepsy, it may not be necessary to call 911. However, you should call 911 if the seizure lasts longer than 5 minutes, another seizure begins soon after the first one ends, the person does not awaken after movements have stopped, the person has a medical condition such as heart disease, or you think anything else might be wrong. Basic first aid for bee stings. Bee stings are either annoyingly painful or deadly, depending on if the victim is allergic to the venom. Use these bee sting first aid tips. Get the stinger out any way you can to prevent more venom from being delivered. It is a myth that any particular way is better or worse. If the person is known to be allergic to bee stings, use an EpiPen to prevent anaphylaxis or call 911 if none is available. Use a cold pack to reduce swelling at the site, but take care not to cause frostbite. Use an antihistamine like Benadryl to reduce swelling and itching. Try ibuprofen or Tylenol for pain. And monitor the person who was stung by signs of anaphylaxis, including hives, redness or itching in other areas of the body, and shortness of breath. These are the references used to create this training. Thank you for your time today.